I want to talk about something that's crucial for all healthcare professionals to understand: health inequalities. Health inequalities occur when there are differences in healthcare across different populations. These disparities can be due to a variety of factors like age, gender, ethnicity, sexual orientation, socioeconomic status, geographical location, and inclusivity issues. Let me break it down a bit. Imagine two patients, both with the same health condition. One lives in an affluent area with easy access to top-notch healthcare facilities, while the other is in a rural area with limited resources. The outcomes for these patients can be drastically different simply because of where they live. Or consider gender and ethnicity. Women and ethnic minorities often experience different levels of care compared to men and majority groups. This can lead to poorer health outcomes for the marginalized groups. Now, what can we do to reduce these disparities? From a healthcare professional's point of view, it starts with awareness. Be mindful of the unique challenges that different populations face. Ensure that your practice is inclusive and accessible. Training is another key aspect. Make sure that you and your team are educated on cultural competence and bias reduction. This means being aware of your own biases and working actively to mitigate them. From a patient's perspective, it's important to advocate for yourself. If you feel that you're not receiving the same level of care as others, speak up. Seek second opinions if necessary, and don't be afraid to ask questions about your treatment options. Community engagement is also vital. Healthcare providers should work with local organizations to reach underserved populations. This can help bridge the gap and ensure that everyone has access to quality care. Lastly, policy changes are essential. Support policies that aim to reduce health disparities, whether it's through better funding for rural healthcare or initiatives aimed at increasing diversity in the healthcare workforce. If you want to dive deeper into this topic, especially in the context of rheumatology, join me at the Therapy Expo tomorrow for a workshop on this very subject. We'll discuss specific strategies and real-world examples to tackle these inequalities. Thanks for listening, and let's work together to create a more equitable healthcare system.